Are you or a loved one facing a cancer diagnosis? Understanding your treatment options is crucial. Today, we're exploring Keytruda Qlex, an innovative subcutaneous form of a powerful immunotherapy drug, designed to make your treatment journey more convenient and accessible. Keytruda Clex is a groundbreaking subcutaneous injection, offering a new way to receive the immunotherapy drug Keytruda. This advanced formulation combines Pembrolizumab, Keytruda's active ingredient, with berahyaluronidase alfa-pmph. This additional component helps the medication disperse and absorb quickly under your skin. The primary advantage of Keytruda Clex is its administration. Unlike traditional intravenous infusions that can take around 30 minutes, Keytruda Clex is given in just 1 to 2 minutes. This means you can often receive your treatment in a medical clinic or doctor's office, rather than an infusion suite. Keytruda Clex received FDA approval on September 19, 2025, following positive results from a Phase 3 trial. This study showed that Keytruda Clex was as effective as IV Pembrolizumab, with similar progression-free survival, and overall response rates. This offers a significant step forward in patient care. Cancer cells are often masters of disguise, evading detection by your immune system. They do this by producing proteins like PD-L1 and PD-L2, which bind to PD-1 receptors on your T cells. This binding essentially puts the brakes on your immune system, allowing cancer to grow unchecked. Keytruda Clex's active ingredient, Pembrolizumab, is an immune checkpoint inhibitor. It works by binding directly to the PD-1 receptor on your T cells. This action blocks the interaction between PD-1 and the cancer cell's PD-L1, PD-L2 proteins. By preventing this handshake, Pembrolizumab effectively releases the brakes on your T cells. This restores their ability to recognize and destroy cancer cells. In essence, Keytruda Clex helps your own immune system fight the cancer. Keytruda Clex is approved to treat a wide range of cancers, either alone or in combination with other therapies. Your doctor will determine if it's the right treatment for your specific condition. It is indicated for various stages of melanoma, including unresectable or metastatic forms, and as adjuvant treatment after surgery. For non-small cell lung cancer, NSCLC, it's used in combination with chemotherapy for metastatic cases, or as a single agent for specific PD-L1 expressions. It also treats resectable NSCLC as neoadjuvant and adjuvant therapy. Keytruda Clex is also approved for malignant pleural mesothelioma in combination with chemotherapy. For head and neck squamous cell cancer, HNSCC, it's used for metastatic or recurrent cases, either alone or with platinum and fluorouracil. In urothelial cancer, it treats locally advanced or metastatic forms, sometimes in combination with enfortumab vedotin. It's also indicated for Bacillus Calmette-Guerin, BCG, unresponsive, high-risk, non-muscle invasive bladder cancer. For microsatellite instability high, MSIH or mismatch repair deficient (dMMR) cancers, including colorectal cancer, Keytruda Qlex is an option for unresectable or metastatic solid tumors. It also treats gastric cancer and esophageal cancer, often in combination with chemotherapy depending on HER2 status and PD-L1 expression. Cervical cancer patients with locally advanced, persistent, recurrent, or metastatic disease may also benefit, often in combination with other treatments. It's approved for hepatocellular carcinoma, HCC, and biliary tract cancer, BTC, the latter in combination with gemcitabine and cisplatin. Keytruda Clex is indicated for Merkel cell carcinoma, MCC, and various forms of renal cell carcinoma, RCC, including advanced cases in combination with axitinib or lenvatinib, and as adjuvant treatment. For endometrial carcinoma, it's used for primary advanced or recurrent disease, often with chemotherapy, or for advanced cases that are mismatch repair proficient, pMMR, or MSIH-dMMR. It also treats tumor mutational burden high, TMBH cancer, and cutaneous squamous cell carcinoma, CSCC. Finally, Keytruda Clex is approved for triple-negative breast cancer, TNBC, including high-risk early-stage disease as neoadjuvant and adjuvant therapy, and for locally recurrent unresectable or metastatic cases with specific PD-L1 expression. While Keytruda Clex offers significant benefits, it's crucial to be aware of potential risks. It should not be used if you have a known hypersensitivity to berahyaluronidase alpha, hyaluronidase, or any inactive ingredients. Keytruda Clex can cause immune-mediated adverse reactions. These can be severe or even fatal, affecting almost any organ system. Your healthcare team will monitor you closely for signs of pneumonitis, lung inflammation, colitis, intestinal inflammation, hepatitis, liver inflammation, endocrinopathies, hormone gland problems, nephritis, kidney inflammation, and skin reactions. Hypersensitivity and administration-related reactions can also occur. If you experience any severe reactions during or after injection, your healthcare provider may interrupt or permanently discontinue treatment. If you've had an allogeneic hematopoietic stem cell transplant, HSCT, serious complications, including graft versus host disease, can occur. Your doctor will carefully weigh the benefits and risks. Treatment with a PD-1/PD-L1 blocking antibody in combination with a thalidomide analog plus dexamethasone for multiple myeloma is not recommended outside of controlled clinical trials. Keytruda Qlex can cause fetal harm. If you are a female of reproductive potential, you must use effective contraception during treatment and for at least 4 months after your last dose. Discuss pregnancy planning with your doctor. The most common side effects of Keytruda Clex, especially when used with chemotherapy, include nausea, fatigue, and musculoskeletal pain. However, more serious side effects can occur. Keytruda Qlex can cause your immune system to attack healthy organs and tissues. These problems can be severe, life-threatening, and may even lead to death. They can occur at any time during or after treatment. Contact your healthcare provider immediately if you develop any new or worsening symptoms. Watch for signs of lung problems, cough, shortness of breath, chest pain, intestinal problems, diarrhea, bloody stools, severe stomach pain, or liver problems, yellow skin, eyes, dark urine, severe nausea, easy bruising. Also, be vigilant for hormone gland problems, persistent headaches, frequent urination, extreme tiredness, weight changes, mood changes, kidney problems, decreased urine, swelling, blood in urine, and skin problems, rash, itching, blistering, painful sores. Other serious signs include chest pain, irregular heartbeat, confusion, memory problems, vision changes, or severe muscle pain, weakness. Infusion reactions, though less common with subcutaneous administration, can still occur. Symptoms may include chills, dizziness, itching, flushing, fever, or shortness of breath. For organ transplant recipients, Keytruda Qlex may cause organ rejection. If you experience signs of a severe allergic reaction, such as hives, difficulty breathing, or swelling of your face or throat, seek emergency medical help. Remember, this is not a complete list of side effects. Always discuss any concerns with your doctor. Before beginning Keytruda Qlex, it's vital to have an open conversation with your doctor. Inform them if you have any autoimmune disorders like rheumatoid arthritis, Crohn's disease, lupus, or psoriasis. Also, disclose if you have received or plan to receive a stem cell transplant or if you've had an organ transplant. Tell your doctor about any history of radiation to your chest or conditions affecting your nervous system, such as myasthenia gravis. If you are pregnant, plan to become pregnant, or are breastfeeding, your doctor needs to know. A pregnancy test will be administered before treatment. Effective birth control is essential during treatment and for at least 4 months after your last dose. It is not known if Keytruda Clex passes into breast milk, so breastfeeding is not recommended during treatment and for 4 months afterward. Keytruda Clex is administered by a healthcare professional as a subcutaneous injection. It is typically given into the thigh or abdomen, avoiding the area around the navel. For adults and pediatric patients 12 years and older weighing 40 kilograms or more, there are 2 main dosing schedules. You might receive 2.4 milliliters every 3 weeks, injected over 1 minute. Alternatively, you could receive 4.8 milliliters every 6 weeks, injected over 2 minutes. Your specific dosing schedule and whether Keytruda Clex is given alone or with other medicines will depend on your cancer type and individual clinical situation. Your healthcare team will guide you through this process. If you miss an appointment for your Keytruda Clex injection, contact your doctor's office immediately for instructions. They will advise you on rescheduling your dose. In a medical setting, an overdose would be managed promptly by healthcare professionals. Regarding other medications, always inform your doctor about all prescription and over-the-counter drugs, vitamins, and herbal products you are taking. This helps them check for potential interactions. Follow your doctor's instructions regarding any restrictions on food, beverages, or activities during your treatment. Keytruda Qlex contains active ingredients pembrolizumab and berahyaluronidase alpha, along with inactive ingredients like histidine, methionine, and sucrose. It should be stored refrigerated and protected from light.